Welcome to Montana Matters. We're joined by Dr. Scott Manhart of Periodontal Specialists of Montana. It's always great to have you on the show. Thanks so much for being here today. We're talking today about the advantages of periodontitis. Of course, gum disease affects such a huge portion of the population. It's very critical to know more about this subject. Why is seeing your dentist so important?
The general dentist is where the primary screening for disease, all dental disease, is going to take place. We have a very close working relationship with the dentist in the area. The general dentist is going to be looking for decay problems, periodontal problems, other restorative problems. If you are a patient who has significant periodontal disease, then the conversation will become how severe is this, something that the general dentist wants to begin treatment in their office, or is it severe enough that they would prefer referring it out to us for a consultation to build a overall treatment plan that will involve both the periodontal management, the restorative management, particularly if implants and things like this will be involved in the ultimate rehabilitation.
Okay, so you're really working together with the dentist's office, and that patient is really a co-patient of both of your offices.
Exactly.
And that dentist is referring that patient to you, the specialist, when that time is necessary. What are some of the signs and symptoms that it maybe is time to have that patient be referred to a specialist?
Well, the list of symptoms for periodontal disease include tooth mobility, temperature sensitivity, persistent bleeding. You know, occasionally everyone gets a little bleeding when they're brushing, but if it's a consistent daily issue, if you're noticing persistent bad breath that doesn't seem to relent regardless of home attempts to remedy it, then yes, it's time to get a consultation. Okay,
so those are some very key signs and symptoms that people should really look out for. They can notice that. Should people do their research on a periodontist specialist?
It's always good when you receive a referral to any healthcare professional in this day and age of the internet to do your homework. Take a look at what their credentials are and where their education was received, and essentially you get a very good picture of what the orientation and emphases of the practice is.
Okay, always important to do your research, know who you're going to, feel comfortable with that decision for sure. Please explain how periodontists treat much more than periodontal disease and maybe how that benefits long-term health.
Well, as periodontal disease is becoming more of a primary indicator for other health problems, including diabetes, cardiovascular disease, respiratory diseases, rheumatoid diseases, particularly arthritis. And consequently, we work with a whole group of both dental and medical specialists, including respiratory docs for sleep apnea problems, internal medicine for diabetic management. You know, this is really, in the last 10 years particularly, has broadened out into a much more multidisciplinary management than it used to be.
Okay, so a large range of health issues, so important to go to your dentist, go to your specialist if you're referred there.
Yes.
Thank you so much for all this great information today, Dr. Scott Manhart. We want to thank you for being on the show, and you can contact them by visiting their website and learn more information. And thank you for supporting local business.